I'm Stacey. I'm a physician assistant. I've been working in this industry since 2000, 2001, doing injectables and just really enjoying the ride because it's an innovative industry and really exciting because you make a big impact in people's lives. We're going to start in on some slides. Facial plastics is a special branch of medicine in which we deal, as the name says, with the face. We're not doing tummies, we're not doing breasts, we're not doing buttocks. And so that gives us an opportunity to really focus on what matters most to us and look at what the industry is giving us as far as tools go. Listed here are a few of the things that we do, but of course not everything. But laser and light-based treatments have become a mainstay of the industry. Injectables is something I'm going to go into real detail about. Skin treatments. This is really the foundation of our clinic. If you're not already doing the basics, taking care of your skin, the rest of the stuff, it's going to help some, but this is what you're doing at home on a daily basis that's going to make the biggest difference. Protecting yourself from the skin irritants, pollutants, toxins, and then having maybe some microdermabrasions, chemical peels, using some of the cosmetic products that are out there to help brighten your skin, decrease the dryness, so moisturizing your skin. Amy is a great resource if you may have some questions about that. The triangle of youth. So this slide I've included because recently there's been some real innovations and the way that we approach patients has changed a bit over just the last few years. Looking at this slide, this V shape where the cheeks are nice and high and everything looks to be just as it should. There's no wrinkles, no lines, the lips look nice and full. And then as we age, gravity takes over. We lose some of the natural building blocks of our skin, the collagen, the elastin, even the hyaluronic acid. And the line changes from being across the nose and through the cheek area to being across the chin. Heaviness. Some people say sagginess. We don't like to use that word. So this triangle of youth is something that's changed the way we start to assess patients. And in looking at the options that we have available, we used to fill in some of the lines to try and combat some of that sagginess. But now we're looking at actually lifting the face and trying to create more fullness and restore some of that triangle. Injectables. So a couple of broad categories. There's the surgical procedures, which again, Dr. Lichtenberger is going to talk about, and then the injectables, which include the fillers and the Botoxes. And that's what are the in-office treatments with very minimal downtime. Minimal being you come in for lunchtime and by the time we're done an hour later, you can likely go back to work. You might have some redness, occasionally some bruising, but there's very minimal downtime. Advancements are made seemingly every week. We have somebody calling us or a report released about a new product that's out. We filter through these pretty rigorously, trying not to start implementing the latest and greatest. We make sure everything is time tested before we bring it into our clinic. Cost effective and pretty low risk. Okay, so this is a patient who came in saying that I feel like I'm tired and everybody thinks I'm angry all the time. So with some Botox, that line is much more relaxed, and that on top is a natural no expression. Down on the bottom is actually trying to frown. And so trying to frown, much more difficult to see that line. Neuromodulator. So this is a generic term for Botox. It's obviously Botox has become a brand name. Dysport, Xeomin are some of the other brand names out there now. Botox has been the industry standard. It's still our very most popular. But having a couple other neuromodulators in the bag is really helpful because they all have their place. And so again, a nice slide here showing some before and afters and the smoothing effect that can occur. And this is probably a month after maybe the bottom picture. That doesn't happen in the office. It's not immediate. It does take some time for those lines to relax. The Botoxes and Dysports and the neuromodulators last 3 to 4 months. Some people get a little bit longer. some not quite as long. It depends on how expressive your face might be, and sometimes on your just general metabolism. Again, no downtime, well tolerated. Some good before and afters. When you come in and we start to sit you down and evaluate, we look at the muscles. And this picture on the left shows the muscles that are the most important in facial expression. It's not as simple as just putting Botox where you have a line. We have to actually work with how the muscles are moving, so the dynamic movement of your face, as well as looking at some of the static movements, or just when you're at rest. Some people don't want to change the dynamic lines on their face. They say, I don't want the lines, but I want people to know when I'm surprised or when I have a question. They want to be able to raise their forehead and have some lines. So all of that can be custom tailored. That's a nice picture, because when we look through you, that's what we see. And the slide on the right has some really nice points of all the places that we now are injecting Botox, including around the mouth. It's a nice before and after. So in looking at this, this is another, what kind of product was used or what was done here. And this is a little more subtle, so that little line there by her cheek was intentional. And so what we've done is added a little filler to the cheek lines. And this is a nice example of that triangle of youth change. The squaring of the jaw is improved actually by augmenting or increasing that cheek line. This is, I'm going to step away from the camera here. This is a nice chance to look at the corner of the mouth changes. And that's just from putting some filler up in those cheek lines. So it's incredible how much change you can make in an area when you don't even put filler there. You get an effect in another zone as well. A good slide documenting all the areas that we're now injecting these fillers. So you can imagine we have a lot of fun with them. They can be injected nearly everywhere very safely. We inject into the hands. Earlobes has become one of those things that we inject people with sagging earlobes. It's kind of a hard thing to believe, but it happens. Fillers work by addressing the lines. The Botox works by addressing the muscles. Fillers actually get into the fine lines all the way down through what we call folds and wrinkles. So this slide shows the epidermis all the way down into the dermis. We're adding volume, fullness to the skin. And it's not just about putting in, it's how much to put in and where to put it in. The hyaluronic acid fillers, and I intentionally put that up there. So these are naturally occurring sugars. We have these in our skin already, and as we age, they break down. Same with collagen and elastin. The volume correction from these HA fillers lasts 6 to 9 months, longer in some and not as long in others, depending on your metabolism. There's some newer products like Voluma, which can last almost 2 years in some patients. This is new one here, Restylane Silk. I wanted to mention that in particular because it's recently come out, and it's a twist on a product we've used for years very safely around the mouth. And now they've made it actually a little bit smaller molecule and smoother. And so when we're injecting lips and augmenting lips, it's a wonderful wonderful injectable. And this is a nice, I like this slide because it shows that sometimes it takes more than one syringe. Sometimes you need 2, and in some cases it's a more extreme case where we need to use 3 syringes. And so the top shows before, after 1, 2, and then the third one you get a nice correction. And the bottom slide, you know, you can argue she didn't even need anything maybe. But after the first syringe, the nasolabial or the smile lines are virtually gone. So this is going to be a before and after. And this is a combination of some hyaluronic acid fillers and some Botox. And same with this slide. This is a nice combination, hyaluronic acid filler and Botox. So you could see what I like to look at here is just that she looks happier on the right. She looks a little more refreshed, a little more natural. Another nice slide, a little injectable underneath the eyes. Juvederm Voluma. There's some special fillers like Radiesse. It's a different twist on the hyaluronic. Instead, it's a calcium hydroxyl apatite. Sculptra is another filler we use. It's got a longer duration. It stimulates collagen as well. Really useful for volumizing deep cheek and temples. And Artefill. I included this slide. I feel like it's really important to mention. If you go to our website, we have specials and events, and we're running a monthly special every month. And so there's always something going on. And as well as the bottom is a Brilliant Distinctions program, which gets you a number of different discounts along the way. So you want to talk to one of the girls about these two programs and look for our different specials. So I kind of went through that quickly. Are there any questions? Does anybody have any burning questions that you'd like me to address? I was that thorough.